I had a bilateral mastectomy, and that surgery went well. And then with recovering from that, I worked with the team in order to make sure my mobility was still all right, and a lot of other visits. And then I got my oncotype score back, which shows which helps determine whether or not someone with my type of breast cancer would benefit significantly from chemotherapy, and that number came back high. So mine was 43, and usually around 25 is the cutoff for needing chemos. Hearing those numbers, it did do the kind of like, but I'm so healthy, I was, I think I was doing everything right. So it's kind of that like, why me again? But then the why not me? So what can I do then? I started looking at what are the other lifestyle things that can help me as far as getting through chemo, as far as minimizing the neuropathy that kind of like the tingling sensation or numbness that can happen with hands and feet, especially with Taxol, which is one of the drugs that I'll get.
In integrative oncology, which is what I do here, we practice evidence-based medicine. It's a combination of conventional therapy that patients get with radiation therapy, surgery, and their medical oncologist, along with complementary interventions that address the whole patient living with and beyond cancer, body, mind, and spirit.
When we designed this 10 years ago, there was a lot of information in the research literature that having exercise, having a dietitian, eating right, seeing oncology social workers and counselors, and reducing stress could make people feel better, improve their quality of life. But what we know now is that information is coming out pretty fast and furious, where the research is saying not only does it improve your quality of life, but that it can actually impact your survival from a given disease.
We have lots and lots of evidence, particularly in breast cancer, that there are a lot of ways to really improve survival. And these include exercise, just 150 minutes a week. There are studies that show that mortality from breast cancer death is diminished 30 to 50%, depending on the studies you show.
I started looking at all of the different evidence as far as lifestyle medicine, conventional medicine, integrative health, whatever evidence-based information is out there, in order to minimize my side effects and to optimize how I can get through treatment.
When I met Michelle, she was about 4 weeks before surgery. We discussed her risk for lymphedema because she was having lymph nodes removed. And then we discussed all of her post-op exercises that she should be doing after surgery, but before she saw me. And then I also took baseline measurements of her arms so that we could have something to compare it to after surgery. I'll be teaching her exercises she can do at home and in the gym to, achieve full range of motion. And then when she has full range of motion, and usually once the doctor says it's okay, which is typically about 4 to 6 weeks after surgery, we can start strengthening.
Our dietetics team really works hard to make sure that nutrition is a key role in the patient's care. We really work to make sure they're maintaining good, proper nutrition as they're going through treatment. We work a lot with cancer prevention all the way through their diagnosis, all the way through the end of their treatment. It's very easy for patients to become malnourished, and what we do is be an advocate for them as they're working their way through their treatment and their treatment process in order to provide them with sound education and sound advice about proper nutrition. We'll really encourage a lot of good fiber, healthy fats, omega-3s, lean proteins, and limiting things that have added sugars or processed foods and red meats. So anything that is very pro-inflammatory is what we want to try to prevent for them while optimizing the other nutrients with the other foods that they're eating.
I think it used to be more like either or, like you're the person who says no to chemotherapy and you're just going to do the natural, nutrition and everything, and then, or you're the person who just does conventional and then kind of ignores that. But really, evidence has shown us that the lifestyle medicine approach is best when we take what is beneficial from conventional medicine and we take what is the evidence-based healthy lifestyle practices, and we use all of them. And that's what I want people to know is like, reach out and see what there is. Maybe it's not all right for you, and I don't think everyone needs to do this or that, but at least get that knowledge, because I believe knowledge is power. Dr. Goodman recommended acupuncture, and I believe that there are some studies that show that it helps some with neuropathy, and so I was like, okay, well, I'll try it.
Acupuncture provides relaxation, stress relief, can help with digestion. It really is a supportive role for the cancer patient for side effects from chemo and other medications they get put on.
All of our providers in all of these subspecialties are oncology certified, so they have additional training that says, I know how to take care of somebody with cancer.
Breast cancer is not the diagnosis that it was even 5 or 10 years ago. So get screened, and then you have all of these different choices. Trying to learn to like let go, like, okay, I just need to take it one day at a time, trust my team, and go from there.